Okay, it's Sunday, July 19th, 2020. The time is 13:16, 1:16. My name is Sam. This recording is really kind of important today. It's Clendenin State Hospital. It's being made available for any attorney out there that wants to listen in right now and also afterwards when we're done. This is regarding COVID-19. Recently we had 10 patients out of Unit 17 who tested positive and are now have been moved to Unit 5. And it's kind of alarming when you think about it. I don't know the number of patients that were being housed currently in that unit, but to take 10 patients out of that one unit and move them to Unit 5 is, to me, it's alarming.
Well, my son is one of them.
Yeah, Margie is a special guest. I'm going to let her go first because from what my understanding is, she tried to tell this hospital that the staff in there were not doing their jobs. They were not wearing masks. I'll let her speak for herself and let her go first. And so
okay,
that we'll have an understanding.
Your name is Sam?
Yes, go ahead, Margie.
Okay, thank you very much. Yes, my son was in Unit 17. He did get the virus. He was transferred to another unit, I believe, number 5. And I called several times. I called actually 3 times. The first time I called to report that the staff was not wearing masks. My son and another person on Unit 17 were the only 2 patients wearing masks. None of the staff was wearing masks. They refused to wear masks. So I called and I talked to somebody in administration. I don't know if I need to give you their name, but I did call to report it. Nothing. This was in June. Nothing ever happened. I talked to my son and he said they're still not wearing their masks. And I was very nervous and upset because my son is not in good health, and he could get this virus very easily if it wasn't taken care of with staff members wearing their masks, which they weren't. So I called, and I even gave the names of the people. The second phone call, I called again. This person gave me their private line to call, Coalinga, in case they did not wear their masks. And I had to call again, and I gave them names, specific names of staff members that were not wearing their masks. Then all of a sudden, they would, and then they'd take them off. One of them would just wear it around his neck and around his chin, and when he saw a supervisor walk in, he very quickly would turn around and put it on. But the minute they left, they'd take them off again. Now my son has the virus, and he, like I said, he's been transferred. The place in Unit 17 is filthy, dirty, urine everywhere. They don't even go in the urinal. There's urine on the floor. There's one patient who walks around barefooted, walks right into it, and tracks it all over the unit. It's a filthy place. And I'm very, very upset because my son is now quarantined in the unit number 5 with the virus. And I had told when I had called the administration department that if something wasn't done, that I was going to go to the media because I have had it. This is my 3rd phone call now that I have made to you people at Coalinga about what's going on Unit 17. And as you can see, it was in Unit 13, then it was in Unit 18, and then it went into Unit 17. Yeah, it's a terrible thing. A terrible thing, and somebody needs to do something about this.
Margie?
Yes?
Margie?
Yes.
Stand by. I'm the host. Hold on a minute. Margie, do you remember the administrator that you talked to?
I talked to a lady named Karen.
In the administration?
And she was, yes. She gave me her private line, and this is the person I have called and left messages. She was nice enough to return 2 of my messages. Excuse me. But
Mother,
and her name was Karen, and
Mother, why don't you go get some water, Mom?
Name. I'm sorry.
Why don't you get some water, Mother?
Your son is asking you to get some water.
Thank you.
Some water, Mom.
I will. That's okay. Thank you. Are you all right, Cord?
He's concerned about you. He's asking you to get some water.
Okay, I'm getting it right now as we speak.
He's concerned about you now.
Bad.
Now, I think the person that she's referring to is Trumbley.
Okay.
She's the yes person for Brandon Price.
Yes person.
And I
Margie,
deliberately
I'd
wanted
like
to
to
get
say
that on
something.
record.
This is Ed Lopez on Unit 19.
Yes.
I've been in this hospital for approximately 3.5 years now, and I've actually worked as janitorial on Unit 17, and I can attest to the filthiness of that unit. I have also worked on a Unit 20, which is a form of an MDO unit, to where I would come in at 9 o'clock in the morning, and it was just filthy. I mean, the restrooms were disgusting. The day room was disgusting, and I come back a couple hours later for some overtime, and it looked like it did when I came in at 9 o'clock in the morning. And I'd like to say that I can attest to exactly everything that you're saying. And I absolutely think that you should go to the media with how this place is run.
Yes, I told her that I would, because enough is enough, I told her. This is my 3rd phone call to you, I said to her, and enough is enough. People are getting sick, and the staff members, they go out to lunch. I heard they've changed the protocol on this, but they go out to lunch, and God only knows where they're going to lunch and can bring anything back. Now I heard that they're swabbing them or they're testing them if they go out to lunch and come back. Well, that's too late. I mean, you know.
I'd like to say they're not testing them, they're screening them, they're checking them for a temperature. That's all they're doing.
Okay, that's it. Okay, yeah. So thank you very much for
Karen, this is, I mean, Margie, this is Sam again. How far before this happened to your son did you warn them? How far before that happened did you warn them?
It was either the latter part of May but I know it was sometime in June.
Oh,
but I've called 3 times, and I just called in July. Okay. I just called July. It was around July 8th and 9th was my 3rd phone call to them, and they did finally, after my second phone call, that they started to wear masks. But like I say, soon as somebody with authority, like a supervisor, walks in, even supervisors aren't even wearing them. There was a supervisor that was promoted to be a supervisor. I mentioned her name not wearing a mask, and then she got promoted to be supervisor.
Yeah.
That doesn't even make sense.
This is an ongoing problem that we're facing right now, and that's why we're having this conference call, because we're trying to prevent more problems from happening throughout this hospital. We don't want any more problems to occur that's happened to your son. So this is why you're important to us right now, and we really do appreciate
I'll tell you something else. My son almost died there. They said it was valley fever. I don't know what all it was. My son could tell you more about that. It was sent to the hospital. The doctor gave him some antibiotics, 2 different kinds of antibiotics that he almost died at the hospital. It's in the records. It's in his file, and I was afraid to call Karen for the simple reason that they would turn on my son. They would write things in his chart if they knew who had reported them. And but I said no. I've got to. I won't mention my son's name, but I need to call and report this. Are they not aware that their staff is not even wearing masks? Don't they make rounds and check and see what's going on? But it's terrible. It's just terrible. And if my son dies from this, believe me, I will be suing. I will be suing.
We want you to know that right now what you're doing, we're hoping that we can do something for your son, but you actually might be saving lives, other lives as well, because
they retaliate on a patient there if they complain. If they complain about something,
and we thank you so much for what you're doing right now, because you are going to save lives, believe me, because we don't get people like you too often here to stand up and protect us, because we know that they're not wearing masks.
Right.
How else could they have gotten it? There's no other way that they could have gotten it, and so they're going to come up with somebody went out to medical, but we know that's a lie. So thank you so much for speaking up for us and telling the truth. They can't
blame it on visitors either, because I was told that there's no visitors allowed. Yeah. So it's the staff that is bringing it in and not wearing the mask. They're giving it to everybody there.
Yes.
Well, I'd also like to say that this is Ed Lopez on 19 again. I came in contact with somebody who apparently had the COVID, and they did the tracing and they did the test. Fortunately enough for myself, I came back negative, but I battle HIV as well as asthma, and so my immune system is compromised as well as respiratory. I'm prone to catching things. So it is deadly, it is dangerous, and I think that more people in society, Margie, need to come forward and help us, because we are helpless in here.
Absolutely.
And if we as patients try to stand up for ourselves, like with your son, we get charted on, or we get
charted on.
Punished.
I know. There's things in my son's chart that are lies. That are complete lies. They put complete lies.
We're going to look out for your. We're going to look out for your son, and we're going to look out for everybody in here that's being affected. We're going to do our best to look out for people that have this virus. We're going to do our best.
Okay, now what is the procedures when they go to Unit 5 and their vital signs are good and their temperature is normal? And how often do they test them?
This is something
I can answer that, because, like I said,
we're going by what your son has told me, and it's very scary what he's told me this morning. And we didn't know this, or most of us we didn't know, and it's very scary to us what he told me. I'm hoping that it's not true. I'm hoping that they just made stuff up. But it's scary what he told me, that there's no hope once we go to Unit 5.
It's not.
We got to do something. So that's why hopefully that these lawyers that are listening in on this call, even today and maybe tomorrow morning, they're going to take some sort of action against this hospital to help people like your son and the rest that are in Unit 5.
Right.
So the protocol for do you need names of staff members that weren't wearing masks? They're probably wearing masks and shields now, but they weren't at that time, so it's too late. I mean, they've already infected everybody.
They're not. There's people that are working over there in Unit 5 that yesterday or day before worked over in my unit. They weren't wearing masks.
My God.
They're still not wearing them. And that's what's making me very upset. They give them the nurse's station, and they feel that they can take them off, and they can't. They need to wear masks, and they're not doing it yet.
The lady
and that's why I needed to do this conference call, because they have to do it, or they need to stay home.
That's right. That's right. They should be written up or fired. They need to have a policy that it's mandatory. And this Karen did tell me on my second phone call to her that it is mandatory that they wear them. And so why aren't they doing something about it if they're not wearing them still? Well, write them up. Give them a warning. And if the warning doesn't work, then tell them that they're out of a job. I mean, come on. They're infecting everybody everywhere.
Yep, I agree.
So the protocol for it is when we come in contact with somebody who has COVID, a staff member, the protocol
somebody just called the host. Who's calling me?
This is
Somebody just said Sam. Who was that?
Orozco in Unit 8.
All right, Unit 8, go ahead, Lefty.
Oh, can you hear me?
So,
yes.
Back to what I was saying, the protocol is when we patients come in contact with somebody who has the COVID, they do the tracing, the contact tracing, and they're supposed to move us to Unit 5 pending the results of the test, and they did not do that for Unit 19. They tested 4 or 5 people on this unit. They're waiting until you get it to move them, potentially putting other people on that unit in harm's way. So that's the protocol, is what they're supposed to do. There's a memorandum that says that if you come in contact and they believe that a patient has it, they are supposed to move that patient to Unit 5, pending the results
Unit 5
of the
is only
COVID
if test positive.
No, right, and so I'm running around here for 4 or 5 days wondering, do I have this or do I not have this? And I'm on the unit potentially infecting other people.
Yeah, but they don't move you to Unit 5 until you're positive COVID-19. That is the policy.
Sam, that's Orozco.
Yeah, I know, Orozco. Okay. Is anybody else checked in from Unit 1, 2, 3, or 4?
I want to know, after they test my son, I heard it was they test him once a week or 3 times. They have to test negative 3 times in a row. And then where do they move them to? Do they move them back to their unit that they were living in, or do they move them to another unit? What's the procedure?
These are questions that we don't have answers to. We're all patients in the hospital. We're not staff. There's lawyers that are listening in, and they're only listening in, and we're going to have to get answers to these questions. We don't have the answers.
Where do we get who do we call to get these answers? Administration?
Administration,
Mother.
yes.
Yeah, Sam?
Yes.
Mother, Cord Curtis, could I say something, Sam?
Yeah, go ahead, Cord.
Okay, hi. And thank you, Mother, for being on the phone. I appreciate it. Okay, here's what I've heard on the discharge from Unit 5. I heard it yesterday from my shift lead on Unit 17 before I was transferred over here. He got the email. Today we have a float that came from 17 who came into my room today and told me what the discharge criteria is from Unit 5. Basically, there is no discharge criteria. Once you've been tested negative for 3 times, they will then move you to another hallway on the same unit for what they call rehabilitation. And so my thinking is that if I test back negative 3 times, now they're going to move me to another hallway, but yet I still have to share the common day room. I still have to share the hallways, the restroom, the showers, the pill line. I have to share everything still. There is no set discharge criteria from this unit as of today. And so what the new findings are is that that one time months ago their belief was if you catch the COVID-19 that you create antibodies in your system, in your body, that will fight it off again. Now it's proven that that is a falsehood. You can test positive again, and when you test positive again, the fatality rate is above 80% because it turns into like a hyperstream into your system. So what I'm thinking is If I'm testing negative 3 times, they're keeping me on this unit with COVID-19 positive individuals. It's just a matter of time before I test positive again and then really have probably a bad turn for the worse. My mother was alluding earlier about me almost passing away in 2018. Everybody that knows me knows that that's a fact. I had septic shock, which has a 65% fatality rate. I have underlying symptoms or underlying conditions that I'm pretty lucky right now to be asymptomatic, to be quite obvious with you, in COVID-19. But there is now no set discharge criteria off of Unit 5. Now, if my mother or an attorney or somebody else calls up the administration, everybody on this line knows what they're going to say, that it's a HIPAA violation. They can't talk about it. They're not going to talk about it. And see, that's the problem that we have. That's why that I'm going to have to probably spend some of my money and get an attorney, because there is no discharge criteria. The only way for me to get off this unit now is to force them in court to get off this unit. Well, and that's what I'm going to have to do. I'm going to have to go to the media. I'm going to have to do all of it just to get off this unit.
Excuse me, Cord, some of the attorneys that are listening in are the attorneys that represent the prisoners in the state prison. Rosen, Bien, and Galvan, they will be listening in to this conference call, so there might be help on the way for you. So just stand by on that.
Cord, maybe you should give them your phone number.
No, we have it. They have it. Don't worry, they have it.
No, they can contact me, Mom. Don't give
They have it, and they will be in touch with you in that regard.
See, it's just not me.
What I need to find out during this call.
What happened on Unit 17. When they transferred Mr. Hernandez, he was the first one that was transferred. Then they decided they had to transfer 2 other individuals. Well, those 2 other individuals, on the morning that they were transferred, this hospital knew that they tested positive for COVID-19. I was in line behind one of the individuals that had tested positive for our breakfast, as we get in line for our breakfast. I had no idea he had tested positive until a staff member told me, back up. I backed up. The staff member later told me that man is going to be going to Unit 5. He's tested positive along with another person. My point is, they knew he was positive. They knew the other man was positive, but they've got him in a line with everyone else getting breakfast. And so, to me, it makes no sense at all. And what Ed had told earlier about him cleaning Unit 17, Mr. Hernandez did a wonderful job in the bathrooms, Kivacking, cleaning. I Kivac the showers, but it only lasts for an hour, and then there's urine all over the place. But what's so disgusting is this unit that I'm on right now, Unit 5, is just as disgusting as Unit 17. Last night, I could not even walk into the restroom because there were so many puddles of urine on the floor. And I'm not exaggerating it. I was told this morning by the shift lead that this unit is supposed to be cleaned every 2 hours. They're not following. They don't even wipe down the doorknobs. They're not doing anything. Yet last night, they're supposed to serve us in our rooms. We're supposed to be isolated as much as possible. We're supposed to have our meals served in our rooms. Last night, a staff member made the decision on her own that she didn't want to do that. And I know what it's from. It's from laziness. She takes all of our sack lunches and throws them onto a table. Well, they all have our names on them. Sack dinners, I should say. So now you have people that are COVID-19 positive that are now cross-contaminating with other people because they're touching everybody's bags looking for their meal. They throw a thing of bag of milk out there, so they rip into the milk like savages, and they're touching all the milks. So it's all cross-contaminated.
What was her name?
This morning from an individual on this unit that a disgusting person on our unit that walks around barefooted through urine and traces it all over the place. Now he's over here with me. I can't get away from this guy. He is having a janitor who just cleaned the bathroom the janitor is opening up the refrigerator, going in and getting waters for us, or for that individual. It's not stopping. This isn't stopping.
What's that supervisor's name?
What's that?
What was the supervisor's name that did that?
So I didn't say a supervisor.
I said the shift lead that did that.
Oh, the shift lead? Mariah.
Okay, thank you. I wanted to notice that for the record.
The people that weren't wearing masks, too, in Unit 17.
I'll give those to him. I think Mr. Hernandez is on the phone. He witnessed the water and the other things, I believe.
But I wanted to know the shift lead's name because the supervisor is going to be listening to this recording tomorrow morning. The program director is going to be listening to this recording.
She represented it that the senior site tech has the authority to do whatever they want to do as far as dispersing the meals. And I don't believe Mariah is the shift lead, but they have the right to distribute the meals however they choose to distribute them.
You're put into Unit 5 to get over this this disease or whatever, and you're right. You might as well just have stayed in 17, in Unit 17. Why did they even move you? It's the same thing.
I should have refused the test.
Yeah.
It's worse over here.
Well. So the Unit 5 is just as filthy as 17. Is that correct?
Oh, absolutely. I'm surprised. Isn't anybody from Unit 5 on this line right now?
I'm patiently waiting. Daniel Hernandez.
Well, I introduced you a couple times, Daniel, but you never said anything.
Oh, no, I actually felt that I would wait or that I was asked to wait.
I'm sorry. Danny, I wanted you to say something.
Go ahead and report, Danny. Can you corroborate that?
Yes. I can corroborate everything as far as 17, and then having arrived here on the 13th, from the beginning, I was the first one diagnosed with the COVID, and while I was here, I've been denied writing paper. The unit has been filthy. I was denied canteen. I was denied mail, receiving mail or sending out mail because, of course, they won't give me anything to write with. Therefore, since my property was kept in Unit 17 rather, and I was sent over here with no means of contacting my family other by phone. I'm presently, Sam may not be aware of this, I'm presently receiving reprisals for doing this, and they're blowing up my chart even as we talk, and I know this verbatim for a staff member that told me, you are not popular around here, and it's being documented. Law enforcement has also been in the unit, and they went down the hall, they went beyond the hall to the stairwell and talked to a staff member in here, ironically the staff member that packed all the property that was kept from me before I got here. I had trouble breathing since I've been here. They said that my oxygen was okay by virtue of my vitals, and yet I was unable to breathe through my mouth, but I could expel air through my nose and intake air through my nose, but I was unable to breathe through my throat, through my mouth. There was disinterest in that. There's been disinterest in the fact that I still have diarrhea. I have chills all over my body. I have massive headaches. And the sad thing about it is that they really have swept all this under the rug. Ironically, since what I said went on YouTube, now they decided to clean. After 3 days of not cleaning, they decided to clean. And presently, there's someone in the office, in the bathroom, giving a half effort to clean it. It's just one person. I clean the bathroom, therefore I know what needs to be done, and it needs to be Carfaxed. By state law, it's a mandate that they vacuum and clean the bathroom every day. There's evidence of dirty laundry that is about 5 feet tall in the laundry cart that has been there clearly longer than I have, and it's not been dumped. There are people here now presently that stay in their room. There are people they stay in the room because they're lower functioning and they don't have a clue about what's going on. 2 of them arrived two days after I arrived, and they're lower functioning, and they've been basically just disregarded until I spoke up saying, hey, they're lower functioning, but I want them to have or get everything I'm getting. They're not getting it. They're basically not. One actually went up to the office and in his own way tried to find out what the heck's going on. But they're just basically non-people. And if you're lower functioning and you don't know how to speak up for yourself, you're just being disregarded. And I, on the other hand, go up there and I articulate. I don't complain. I don't bitch and I don't moan. I just question what they're doing, why they're doing it, and how come they're not doing it to our benefit. Again, there are people that are just laying in their bed. They're going by and getting their vitals on occasion, but these guys are miserable. They're lonely. They came over here without their property. They have no means of contacting their family. Perhaps they didn't have the sense to bring a phone book with them, but you could not take anything. They did not allow you to take anything. And no mail is coming. No mail is going out. I'm repeating this because it has significance about the mail.
Are you giving anything like to clean the phones with after each use, the sanitizer, the wipes?
Even as we're talking right now, they're actually wiping the table and the chairs down, and they made it very clear to me that they were doing it because obviously they know I'm behind all of this getting done. And I've been told, they warned me, I'm not getting paranoid, I'm not afraid, I just know what the consequences are, and I welcome them because I've told the truth, and I'm glad that I have Cord Curtis to confirm what happened in 17 because categorically everything he said was true, did happen to him as well as to me, and ironically that's how I caught the COVID virus because I was the first one to get it and come here, and they have no plan for us. They have made up rules as they go along, and again, not even writing paper. You can't even correspond. I've made it very clear that I have legal mail coming. Oh, well, we can't give it to you. You have COVID. And I said, what about sending legal mail out? Oh, well, you got COVID. Well, what about some writing paper so I could document this, at least keep a journal of it? Oh, no, we have no writing paper.
Wow.
Oh, it's just this is too much. This is too much, and you can imagine how families feel. We feel helpless. I hear this from
Margie,
my son.
Later, your son's going to give you my phone number, and I'm going to give you some phone numbers to call to help you out. Yeah, we're not going to accept this. We're going to do something about this. I'm going to give you some numbers that we're going to.
I can't eat. I can't sleep.
We're not going to accept this.
As a family person, a family member, your mother, your father, your aunt, your uncle, they're concerned about you.
Yeah, no, we're not going to accept this. We're going to do something. We can't do nothing during this call, but I'm going to, believe me, I'm going to give your mom some phone numbers to call. We're going to get some help. Don't worry.
I'd like to say that I think that you should get together with society and start rallying for us. We are human beings. We've made some mistakes. We've made some bad choices, but we are human beings. And, what they're doing to us is not treatment. It is punitive. They are punishing us from one end to the next.
Yes.
And I think the media hears the truth and knows the truth about what this place, what this law is doing to us. They are punishing us.
They're minimizing what my medical condition is, and they're saying that I'm getting better, though I'm coughing up phlegm about 3 or 4 times within an hour. I'm coughing up phlegm. Oh, no, don't worry about it. It's not the bad color that it was 3 days ago, so don't worry about it. I'm like, well, I'm coughing. Can I get some cough drops? Can I even get salt to gargle with? Oh, no, we can't do anything. There's no palliative care, nothing that they're giving us to help us. There's guys here that don't have Tylenol for their headaches or a medication for their body ache. I'm fortunate to have medication for a pre-existing condition for pain. But they're not offering. These guys are walking around miserable, and it's really sad. It's frustrating, and that's what's caused me to advocate to the degree that I have. Now, everybody's listening, so I'm going to say this. Any repercussions, anything that happens to me, it's not something that I pursued with the administration, law enforcement, or psych techs. So anything that may happen to me, please just know that, and at some point, try to do what you can to help me. Okay? I'd really appreciate it.
Yeah, don't worry. Don't worry. You got people looking out for you, so don't worry about that. Just don't do anything to provoke it. Just watch yourself and don't do anything to provoke. We're going to watch out for you. Don't worry.
Okay. I'm sorry?
Go ahead, Mother.
I was just going to say, I thought when they moved my court over to 5 that it would be like a hospital setting where they take care of you. This is a disaster.
No, they have a nurse supervisor that is actually the supervisor of the unit. It's not the U.S., but the charge nurse is actually, because this has become a medical unit, it is no longer a regular patient housing unit. So she's the one basically running everything, but we have just been given a new supervisor, a new U.S., and Cord, your mom would want to call her, Jamie, and ask her about what your housing presently is and what the status of your health is. And she can't give up everything, but at least your mom will make a connection with Jamie, the new supervisor, the new U.S. of this unit. She'll be back in the morning.
Okay. Well,
I certainly will do that.
Yeah. All right. We'll do that.
So anyways, I don't mean to interrupt, but I need to check with the rest of the units and see if anybody is still there with me. John, Unit 14, you still there?
Yes, I'm here. Yep.
Yeah, they still wear masks, or are they not wearing masks on your unit?
Half of them do, the other half don't. And one of them is
a
shift lead, and she adamantly refuses to wear masks when she's out here amongst the patients.
Okay, well, we'll see if she has a job tomorrow then. We're talking about Mary Ann, right?
Yeah.
Okay, we'll see if she has a job tomorrow. How about cleaning? Are they cleaning?
It's sporadic. They come out like maybe once a day to clean. They're pretty much leaving it up to the IT workers to clean. They're giving them like everything they could possibly give them to clean and leaving it up to them, when it's actually their job to clean every 2 hours. You know?
No.
So they'll let the IT workers go and do their thing, but it's the psych tech's job to come out here and wipe surfaces and use bleach on the doorknobs and everything. But they're trying to pass the buck on to the IT workers. And the IT workers, and God bless their souls, they're doing the state minimum too. They're under 725.
Right.
So
may I comment on something like that?
They're still not wearing masks. I find that incredible after what happened with 17. That's just mind-boggling to me.
Cord, you wanted to say something?
Yeah, hi, Elo.
Hi.
I can validate. See, what's really scary is that I guess having at least 10 people from Unit 17 having a potentially deadly disease is still not enough for everyone of these staff members in this institution to put their beliefs aside. If they believe that they shouldn't have to wear a mask, that's fine. Don't wear a mask outside of this hospital. But when you're inside this hospital, as a matter of fact, I believe Governor Newsom even is directing everyone in the state of California to wear a mask. So if the governor of the state of California is directing people to wear masks, then why are the psych techs or the staff or whoever inside this institution not wearing masks? Now, when Mr. Hernandez was moved, and then the other two, Mr. Sanchez and Mr. McDonald, were moved, we believed on Unit 17 that they would do a deep cleaning, bring in the whatever and deep clean. Well, when we brought that up to the new unit supervisor, I wish Mr. Hardy was on the line, but she came out of the office after 5 minutes, took the tube of Clorox wipes, tossed it to our chairman, and said, if you want to clean the unit, if you want the unit clean, do it yourself. And that's a quote.
Wow.
And so now, see, and then she went on the second time and she said, we're wearing shields for your safety. No, you're not wearing shields for our safety. You're wearing shields for your safety because you guys brought this COVID-19 into us. And now you're wearing shields. And do you realize, everyone out there, that you have people in the med room that are not wearing masks distributing the medication to us?
Yes, we realize that. Yeah, we realize that.
It's going to stop.
I just want to say one thing.
I promise you guys,
have you
it's
had
going to
enough
stop.
of this? Or are you okay? Or
No. So, Cord, we've realized that too. And one staff member that was in the med room refuses to serve a few certain people because they've asked her, hey, would you please wear a mask while you serve my medication? Because your water droplets are contaminating my meds, and you might give me something. So she refuses to serve those certain individuals. And it's appalling. And I've talked to people on 13 and 15, and what happens when there's a red light on 17? Our staff run over there to respond to the red light. And when they come back, they don't change their gloves or wash themselves down or wipe themselves down. They go right into the office and sit down and wait till they come back out here and then serve our food and then interact with us and do their thing. So, I mean, they're bringing stuff back to us, too. It's just they use the same gloves when they go to that red light that they use when they try to serve us trays next time we have a mealtime.
So this is Ed Lopez on 19, and I had an African-American staff member who normally works Unit 20. He worked our unit yesterday, I guess, as a float, and he served our meals, and he had dropped one of his gloves on the floor and picked it up and put it on and began to serve our trays.
See, that's uncalled for. They have no respect for what they're doing towards our food.
Not only that, but I'd also like to say I was told by a patient up here, and we can't confirm who it was as far as the staff member, but there was a staff member from Unit 17 who came up here yesterday, a nurse, up here to Unit 19. So I don't know. We had Anthony Romero, who normally works Unit 5 when I was on there in 2017. He was up here as a float one night, and he was giving us our medication, serving us food without a mask, and not wearing gloves. Serving our food.
Okay, this is Joe from 16.
Hey, Joe, go ahead, Joe. Report.
Okay. By the way, along that line, the U.S. David from Unit 14 was covering up on Unit 16, and the staff would not get a hold of him, or he was not responding, and so I went to try to get a hold of program. When he came up, he said he was representing himself, program, and possibly higher, because he said, just say I'm representing all of them. And when I brought up about the medroom staff, because that stuff goes straight into our mouths, he said per CDC, they don't have to wear it because it's like they're in an office.
That's a lie.
And so I told him, all of the staff that are going through and using that room as a pathway to get to the back hallway, even though it says not a thoroughfare, I said it's not a single person in an office.
Can I say something real quick? Patient Shirley just came to me and told me that he has chest pains. He told them. They said nothing. They did nothing. Just moments ago. Okay, I just wanted to put that in there. I don't want to interrupt, but he just came and told me he does have legitimate chest pains. He has the past of doing that, but he did tell them that, and he just left my room, and they did not respond.
We've had multiple times in the past on the units where they tell someone that they have chest pains. They tell them to go take a drink of water and go back to your room, and they have found them dead later on. Don't forget, we had that patient that died on Unit 2 because the staff didn't want to help him and was too afraid to go into more detail. Okay, sorry for being late. I had to go and get a few things done.
You're right on time.
A quick report on 16. Staff is not doing social distancing and wearing face masks. It's gotten better. than it has been for them. I will tell you that, but we're still having issues along that line. I do know with the unit supervisors who are supposed to be setting the examples, I've had all the 4 in the program, seen them on our unit at various times not wearing a mask, and they're supposed to set the example. Also, the social distancing. In the nurses' station, they all want to gather around the one side because that's where they socialize, that's where the computers are, and ignore the other half. Obviously not within those computers. They're like 1.5 feet away from each other at the most. As far as it goes with the PDR food that's being passed out in the day room, because they haven't worked out a system, because they're serving, unlike most of the hospital, both carts in the day room, and we don't know. They're not even careful about which side the diet or the regular are on, so people are having to cross by each other. The line to get your condiments is next to the line for the regular, and so you've got that little access way. So within 6 feet, we have 2 lines and a walkway that we are forced to go into.
Where in the hell is the administration in Coalinga? Where are they? They need to make rounds. They need to see what's going on. The governor of California needs to know what's going on in Coalinga. This is ridiculous.
Margie, I think it's time that you call the governor. I think it's time, like I said earlier, that you get out the guns, the ammunition, and start firing at this place.
As
far as it goes,
God.
I've been in different positions hospital-wise.
I thought it was maybe in 1 or 2 units. I'm hearing it from 14, 16, everybody. I'm so sorry for all of you. My heart this is really,
Mother,
really hard.
Are you going to be okay, Mom?
I'm fine, sweetheart. I'm fine. I'm just I'm past the other part. I'm getting angry. I'm getting really angry at the administration. That place should be closed down. Coalinga should be closed down, and everyone that they have diagnosed with the COVID-19 should be in a hospital and taken care of.
Margie?
Okay. This is Joel, again on 16. I do know administration, and I do call them up from time to time. I don't try to overly bother them, so they take more action when I do call them. As far as the social distancing, as far as like the mask and all of these things, I've talked to administration level, both on the clinical, both on the hospital administrator side, which is underneath the executive director. I've called it into licensing. In fact, I think it was Thursday I got a call back from licensing regarding these issues, all of these issues, and they just got back to me on Thursday from when I put in the complaint on the 3rd of July.
But, Joel, you do understand, Cord Curtis, you do understand it's an impossibility to socially distance in this institution. There is no, you cannot socially distance.
Yeah, the beds in the rooms are they're less than 5 feet apart from each other.
I know.
And
you
we
cannot socially distance in this institution. You see, in the prison system, my mother alerted me of this. I knew they've released 8,000 convicts. Well, there's a man down on our unit. Hold on. Margie?
I hope it's
Margie, are you there?
Yes, I'm here.
Where? I wanted to let you know, Margie, real quick. I have a guy here on my unit, a patient by the name of Greg Ding. His wife and his sister are both writing letters to the governor, and he is willing to give you their phone number so you guys can collaborate together and maybe start a fire out there to get this place shut down.
Oh, please do. Please do. The more ammunition we have, the more people they'll listen. They'll listen. They have to listen. Your lives are at danger there.
Okay.
Yeah. One of the things, and this is part of their infection control manual, is they do what's called enhanced cleaning. Every 2 hours, they're supposed to go to the common areas and wipe down the tables, wipe down the chairs.
Joel, we know they're not doing this.
Yeah.
They're not doing this, Joel.
To their own,
not following their own policy.
one of the things also on our unit is they've locked common area rooms because they say they don't have the staff that can monitor them. So they're even limiting our space even more. We're going on 2 weeks that no one's had yard. They claim it's because of poor air quality. However, there's never been a warning for the entire valley that I know of during that time. So we're stuck. We have 50 people stuck on a unit, and they're even limiting what rooms we have to go to. We're at a point that all we have is the day room and our own rooms other than the shower.
Margie, do you have a pen and paper?
Does anybody have telephone numbers to radio stations, TV stations, any of that?
Yeah, Margie, I'm going to give all that to you afterwards.
Okay.
Just have your son get a hold of me afterwards, okay?
Okay.
If you've got a pen and paper, I'll give you a phone number.
A phone number to what?
For Greg Ding's wife that I spoke about a minute ago.
Oh, okay.
Okay. Excuse me a minute. I've got to go, Sam. Call me later. My wife just called.
Okay, go ahead. All right. I got to finish up this conference call. Let me check in with unit number 8. Are they wearing masks in your unit or not? Lefty? You still with me or not, Lefty? Guess not. All right, how about unit 15?
Somebody was going to give me a phone number.
Yes, it's 916.
Say that again.
916.
Yes.
494.
494.
8426.
84 what?
26.
84 what?
26.
26?
Yes. And her name is
Okay,
Lynn.
let me repeat that. It's 916-494-8426?
Yes. And her name is Lynn. And her name is Lynn Ding. She is the wife of Greg Ding at Coalinga State Hospital, Unit 19.
Okay. All right. Thank you.
All right. Go ahead, Joel. You finished or not? I got to go to Richard Grander yet.
Okay, one more thing. Yesterday, we had an incident because of laziness of staff and whatnot. There was one patient that, did a little retaliation. But what they had done is they said, okay, none of the patient janitors can do any cleaning now until Monday when the unit supervisor gets back. And the staff aren't doing any cleaning. And they also said that all of the auxiliary rooms, so other than the day room, everything else is locked. We have nowhere to go, 50 people, and to do social distancing in the day room, we can only handle 14 people. And of course, when the staff is there, they use the chairs. Yesterday, it was after that incident, we had 3 staff members who usually work on 13. The one that came up with a little bit of attitude, and she was in the day room. Well, I believe it's a gentleman. I don't recognize him from 13 or anything like that, but I believe he is from 17, which is a quarantine unit, was up talking to her in our day room with the mask underneath his chin. Now, one of our patients asked him to put the mask on, and he was belligerent about that, saying, I don't have to, and all this. And she got so, angry and, very hateful back toward that patient that he asked the shift lead, and the shift lead pulled her into the nurse's station for the rest of the shift to limit her access to the patients.
Wow. So who was Joel, who was can you describe the male staff member from Unit 17?
I'll get with that because I'm working on getting the names of those.
Could you describe him to me?
He had the facial hair, mostly hair around here, kind of a younger fellow, with a kind of a shorter beard and mustache.
Okay, that's not familiar.
No, I'll go a little bit more into that because I'm trying to find out who he is.
Well, Cord, you reported Rex, didn't you?
Yeah, that's who I thought it was, but he's not. Yeah. He's not old or younger, and he doesn't have facial hair.
Yeah, well, Rex is one that doesn't wear his mask either. So.
Right.
Yeah.
Well,
okay.
Is there anybody Is there anybody online that didn't report regarding their units? Anybody else? Oh no, Richard Grinder, are you still there?
Yeah. Yes.
I think you were the one that told me that your staff is compliant. Is that correct?
Yeah, they're pretty compliant, and I get calls from other unit chairmen.
You're breaking up, Richard. Richard, you're breaking up. Richard.
The staff are not doing the cleaning. Only the IT workers are.
Jesus. You're breaking up, Richard.
Tell you.
Hello?
I think we lost Richard.
Okay.
All right, how about Williams? You still there, Williams?
You hear me now?
Yeah, Richard, I can hear you now.
We're having occasional problems. We have the staff are not doing the cleaning. We got like one or two staff that'll go in and clean the day room sporadically, maybe in the evening, maybe when there's nothing else to do. But it's only the IT workers. There's no IT workers on Sundays and Mondays. For some reason, they've never scheduled any for Sundays and Mondays. We don't have any janitor crews coming in. I think we have a possible problem with the cleanings. They're not cleaning the phones. There are things that we're suggesting they're not doing. They don't really want to be told by the patients what they need to be doing.
Yeah, it's too bad. But they're all wearing masks at all times, huh?
Yeah, I've observed a staff member one time, a doctor, when we were out in a fire alarm that wasn't wearing one, and they said he had one on when he came out, or before he came out, and then he put it on when he went back in. I have our chairman standing here who's out observing what's going on in the unit a lot more. He said that sometimes the staff in the med room is not wearing a mask.
Well, that's pretty important. You know, I don't know. That's kind of an important area. We want them to wear masks at all times.
Well, they always seem to have acted as if that's not important in that room.
Yeah, I know, but I got it from the administration.
Them more often than they used to be.
Yeah.
Often they're not wearing the mask in the office, in the nurse's station, and then when they come to the door, they often put their mask on or bring it up from their chin to cover their nose and mouth. But they often don't wear it in the nurse's station. But usually when they're coming out,
that's been an issue throughout the hospital. They think they're exempt in the nursing station, which is ridiculous. Okay. Thank you for that report, Mr. Chairman.
Hey, Sam?
Yeah.
Sometimes the floors get real
one of the things I like to say,
and you have to go over them several times, and like right in front of the med room, the floor is so dirty that often you have to go over it 3 or 4 times just to get all the crud off of it, and it's not being mopped thoroughly every day like it should be. This is
What
Mr.
unit
Hancock.
is that?
What unit is that? That's 22, right?
22. Hancock's here with me.
Yeah, that's
22?
what said it's filthy.
Yes,
Okay.
Unit 22, MDO unit.
All right. Who just called my name? Somebody else called my name.
No, it's Joe. One of the problems is when they're taking the mask and they're hanging it off the ear or they're putting it under their chin,
if you look at them when they're grabbing their masks, usually their fingers are going inside where those droplets are from their mouth when they were using it before.
Yeah.
And then they
put
that
gloves
on, and then they grab the door handle and handle your stuff.
Exactly.
Yeah, they should be wearing gloves. I mean, they're supposed to be wearing gloves.
Yep.
Well, even
as you can see, Mark, if we don't take
wearing it
some
around
action
your
right
neck
away,
or underneath your chin is not. That's not okay. I mean, you might as well just not wear one at all. If you're just playing around with it and putting it around your necks, and then when a supervisor comes, you put it on your mouth. That's not cutting it. Why I asked what unit that was is because I'm writing all the units that have called in and complained. I need as much information as I can. I'm not going to be calling people about one unit. I want all of the units that are having problems.
And they often wear their mask just over their mouth and not over their nose.
Well, Mark, the previous call that we did was on YouTube. It's called DSHABUSE.com. We did a previous conference call, and it's on DSHABUSE.com. And you'll get more units on there.
Okay. Oh, my God.
Yeah, we did one previously.
Oh, dear Lord.
It's ridiculous. We have a real we're trying to prevent another Unit 17 is what we're trying to prevent. We don't want more people like your son to go through this. And if we don't get this administration...
Have you?
Pardon me?
Unit 24.
What? Unit 24?
Yeah, that's the same thing as Unit 5.
Yeah, that's right. Unit 24 is another Unit 5.
What are you talking about?
No, I know there's
that's
no
where they keep the MDOs that are COVID positive.
It's another quarantine unit. It's another quarantine unit for COVID-19.
Wait a minute. So Unit 24 is also a COVID-19 positive unit?
Yeah,
they moved all the way up there, so the only ones that are up there are people who have tested positive down the MDO hallway.
How many people are on that unit?
I don't know. They have Unit 20. They have maybe a dozen people up there now. But
on Unit 24, there's a dozen people?
He can't even get his legs to walk around. We have walkers and wheelchairs there. 24 is actually two. There's not anybody representing.
How many people are on Unit 24?
That's equivalent to Unit 25.
Well, why did somebody call Unit 24 and find out?
On Unit 24.
I think somebody should call and find out.
12? Does anyone know the answer?
Richard, how many on 24?
What you guys are, is I'm understanding, I had Joe Castaneda, the hospital administrator on this unit the night before last, and their plan, what they're talking about, is moving these people to other hospitals because we're getting boxed in down here. That was funny.
Somebody should
call how
many are over there.
We have to make room in other hospitals
to
take these same people that are positive there.
Richard, stop for a minute, Richard. How many people are on 24?
Call the unit and find out.
Oh, okay. I will.
Give me a headache.
Oh, my
So there's
God.
another epidemic then.
This is worse than I thought.
I didn't know it either.
They said they were just doing Unit 24 to prepare in case things really get out of hand here. But as far as I know, it's been MDOs that they've moved to 24, including people from Unit 20. Ted Susley is up there, and Tracy, whatever his name was, he's from 20, he's up there. Guys from 26 are up there. We don't have anybody from this unit up there yet, but they're all MDOs, including the amputee. And
Where's
that guy,
the health department?
I should have brought it up. This guy has no legs. They won't give him. They won't provide him his prosthetics, so he can't put his legs on and walk. Even though he's on an upstairs unit, he can't even walk around the unit.
Where's the health department coming in? I mean, the licensed health department of the state of California. Where are they that they haven't investigated this? or even
when they're
heard this?
They give them They give the hospital forewarning, and the hospital cleans up. And when they do the audit, they pass. They need to come over here and unannounced.
Unannounced.
They all work for the same people. They all work for the governor.
Okay, one of the other things about the health department is they rarely talk with the patients, but they believe everything the staff tells them, and the staff are lying to them. So they take it at face value.
Okay. Richard Grinder is about to call Ted Cecily upstairs, so this is Kyle Hancock. I have the phone. But he's going to find out how many patients are on the unit and other things that he's going to ask them.
Okay. By the way, in the first part of the COVID-19, where we were more locked down, when we placed complaints with licensing, even about face mask and everything, they said that we're taking the complaints, but per the governor, we cannot go down there and investigate. And in the beginning, they were saying it's probably going to be about 3 months before we can go there. So then they were saying, do you want us to hold on to it, investigate it then, or just dismiss it?
Oh, my God. This can't be happening. This just really can't be happening.
This is happening, and it is happening in real time.
Oh my God.
All right, Mother. Well, Mom, it's your son, but you can't be surprised coming from me. I've patented for over 20 years. You know exactly how dirty the mental health system is, so you can't be that surprised. It's happening. I know you believe everything I tell you, and now it's just been
but I thought maybe 2 or 3 units. I didn't know.
Oh no, ma'am, Mother!
I've got a
it's
list
every
of 1,
unit
2,
in
3,
this
4.
hospital. And Mother, it's every unit
hospital wide.
Yeah, it's every unit. It's not just 17 or 5 or just your son. It's every unit.
They have 28 units in this hospital.
They have staff members here, Mother, that believe that we are subhuman, don't believe we have any rights, and how dare us even indicate to them that they're doing something wrong or they could do something better for us. We're subhuman in their minds, in their eyes, and they are the ones that are bringing in the COVID-19 to us. And so I just don't want you getting too upset, Mother, and too overwhelmed.
Cord,
yeah.
This is Sam. For anybody that cares, Senator Ana Caballero is going to be listening to this recording, and her phone number is 916-651-4012. She's our senator for this hospital. Her number is 916-651-4012, and she is our senator for this hospital. Ana Caballero.
Like the chili habanero?
Ana Caballero.
Ana Caballero.
Callero. Caballero. First name Ana. Anna.
Okay.
She's the senator for us.
Well, what the heck has she been doing?
Well, she has no clue how bad things are here. She has no clue.
Well, after she hears this recording, I hope she does something.
It doesn't really help when we have a truck driver from prison running in this hospital.
Hey, Ed.
What?
He used to be a truck driver in the prison system. That's our director of this hospital.
Okay, my mother will do it. You don't have to keep prodding her to do it. She will do it. Okay.
I know.
Because I'm starting to hear you like prodding my mother to do a lot of things, and she'll do it.
Yeah. Anyways, I got to end this conference call. We've gone way over. So has anybody else got anything more to add?
I just have one more question. Has does anyone know the numbers of the COVID-19 positive people on Unit 24?
I have
Richard,
the numbers
did you get that
Unit
number
24,
yet?
and you can talk to Ted Cecily up there, but right now I'm trying to call them through my other calling card, and I haven't gotten through yet.
Okay.
Oh, this is Joel. Can I say one last thing?
Go ahead, Joel.
Okay. We have people. There's a few patients who've been assaulting other patients and have put them in the hospital, and the staff still, they're walking around the same people doing threats and all. We're trying, someone who ended up going to the hospital from an assault when the one patient assaulted 3 people. We cannot, I've been trying for days, I've been trying for half a week to try to get a hold on them, because coming back from the hospital, they go through a 14-day quarantine in the medical unit 1. The staff in the nurses station who's supposed to answer the phone and take it to those patients does not answer the phone. Every time I call, it's never busy. It's always ringing.
The phone number, the direct line phone number for the nursing station is 559-934-8531. That's 559-934.
Hold on a second.
Mother, you don't need that number.
No, you don't need that
okay.
one. That's for MA1. That's the direct line for the nursing station, MA1. It's 934-8531. That's if you need to get a hold of a patient on MA1.
Okay.
Anybody has the right to call that nursing station.
Is this call over now, Sam?
Pardon me?
Is this call over now?
Yes, we're going to end this call. The time now is 14:29 or 14:28. I'm sorry, and we're going to end this. We're going to do this again later on in the week. I'll let you guys know when. We're going to do an update, and we'll see how things go. I'll let you guys know when and the time. Okay?
So I'll give you a call later and get the telephone numbers for my mother.
It'll be the same number, numbers. I just give you the time and
the attorney numbers and things of that nature. The attorney's numbers and those numbers I'm talking about.
Yes, I will. All right.
Okay.
Okay,
the
goodbye, everyone.
Most likely will be calling you guys, but I'll get you all that stuff. Yes.
Can you tell me if...
all right, Mother.
Okay,
thank you very
God
much,
bless all of
Kurt
you.
and Marge. Thank you very much. We really appreciate it.
Sam,
God bless you,
and God bless all of you. Take care and be safe.
Thank you for
Thank you, and thank you for joining us.
And let's all work together, and we're going to defeat this one way or another. We're going to defeat it. Work together, okay?
Bye for now.
All right, God bless you. Bye-bye.
Hey, Sam?
Yeah.
I'm trying to get a hold of Ted Cecily up on 24. You want me to ask him to try to call you at some point?
Yeah.
He can give you better information, or Tracy. I'll have one of the two of them call you, okay?
Okay.
What
now I got to figure out how to stop the recording.
Oh, okay. All right. Later.
Thank you.
Thanks.